Hi, my name is Rob Mentz and I'm a heart failure cardiologist at Duke. I'm really excited to share some of the recent findings from the EXCEL trial. EXCEL was a large diabetes cardiovascular outcomes trial of exenatide in over 14,000 patients worldwide. The primary results were presented several months ago at the European Diabetes Meeting. And what we found in the EXCEL study was that exenatide was safe, and numerically there were fewer events in terms of major adverse cardiac events in those patients treated with exenatide. This did not reach statistical significance, but importantly was similar to findings that have been seen with other medications in this class. In addition, we found that there was a 14% reduction in mortality. So we were interested in further exploring and better understanding what this meant, this reduction in mortality in a broad population with diabetes. So the results that we're presenting at this meeting, we're taking a deeper dive into this mortality signal. What we did was to develop a risk model to better understand what patient characteristics were associated with increased mortality. And then we looked in a new model to explore whether the treatment effect of exenatide was consistent across groups. And we hypothesized that potentially in those at increased risk for mortality over the course of the trial, that they could potentially have a greater benefit from this therapy. After we completed the analysis, what we found was that the effect of exenatide was really consistent across patient groups. Those at lower risk or those at higher risk really did demonstrate a consistent benefit with respect to clinical outcomes with exenatide. We feel these data are important as we use this therapy in clinical practice. The diabetes space is increasingly complicated with the new therapies available, but these results help support the use of this therapy in clinical practice in a broad population of patients with diabetes. Thank you.